Oh my word. I don't know. Should I ask her?
Please.
Craig replied. After a few deft maneuver, Leona pulled on the loop ends of the bow tie and tightened the knot she had made. After a minor adjustment, she stepped back. Not bad, even if I say so myself, she declared. Craig looked at himself in the mirror and had to agree. She had made it look easy. Jordan's voice came over the phone. She says it's just in her chest. Are you thinking she's experiencing a heart attack, doctor?
It has to be ruled out, Jordan.
Craig said.
Remember, I told you she had some mild changes on her stress test, which is why I advised more investigation of her cardiac status even though she was not inclined.
I do remember now that you mention it. But whatever the current affliction, I believe it's progressing. I believe she even appeared rather blue.
Okay, Jordan, I'll be right there. But one other quick question. Did she take any of those antidepressant pills I left this morning?
Is that important?
I could be. It could be though. It could be. Although it doesn't sound like she's having a drug reaction, we have to keep in mind it was new medication for her. That's why I told her not to start until tonight when we went to bed, just in case they made her dizzy or anything.
I have no idea. Even if she did or not, she had a lot of medication she got from Dr. Cohen. Griggs nodded. He knew very well that patient's medicine cabinet looked like a miniature pharmacy. Dr. Ethan Cohen was a much more liberal prescriber of medication than Craig, and he had originally been patient's physician. It had been Dr. Cohen who had offered Craig the opportunity to join his practice, but he was currently Craig's partner more in theory than in fact. But he was currently Craig's partner more in theory. Uh, the man was having his own health issue and was an extended leave that might end up being permanent. Craig had inherited his entire current roster of problem patients from his absent partner. To Craig's delight, none of his problem patients from his previous practice had decided to pay the required fee to switch to the new practice.
Listen, Jordan,
Craig said.
I'm on my way, but make an effort to find the small vial of sample pills I gave patient this morning so we can count them.
I will give it my best effort, Jordan said. Craig flipped his phone shut. He looked at Leona.
I've definitely got to make a house call. Do you mind coming with me? If it turns out to be false alarm, we can go directly to the concert and still make the entry. Their house is not that far from Symphony Hall.
Fine by me, Leona said cheerfully. While pulling on the tuxedo jacket, Craig went quickly to his front closet. From the top shelves, he got his black bag, and snapped it open. It had been a gift from his mother when he had graduated from medical school. At the time it had meant a mountain to Craig because he had an idea of how long his mom had to have squirreled money away without his father knowing to afford it. It was a sizable, old-fashioned doctor's bag made of black leather with brass hardware. In his former practice, Craig had never used it since he didn't make a house call, but over the last year he'd used it a lot. Craig tossed, Craig tossed a bunch of supplies he thought he might need into the bag, including a bedside assay kit for myocardial infarction or heart attack biomarkers. Science had advanced since he'd been a resident. Back then, it could take days to get the result back from the lab. Now, he could do it at the bedside. The assay wasn't quantitative, but that didn't matter. It was proof of the diagnosis that was important. Also, from the top shelves, he pulled down his portable ECG machine, which he handed to Leona. When Greg had formally separated from Alexis, he had found an apartment in Beacon Hill in the center of Boston. It was fourth floor walked up duplex on Revere Street with good sunlight, a deck, and a view over the Charles River to Cambridge. The hill was central to the city and fulfilled Greg's need superbly, especially since he could walk to several good restaurants and the theater district. The only minor inconvenience was the parking problem. He had to rent a space in garage on Charles Street, a 5-minute away walk. What are the changes we can get away in time for the concert? Leona asked when they were in their way in Greg's new Porsche speeding westward on Storrow Drive. Greg had to raise his voice against the wind of the engine.
Jordan seems to think this might be legit. That's what scares me. Living with Patience, he knew her better than anybody.
How can he live with her? She's just a pain in the ass, and he seems like a quiet, refined gentleman. Leona had observed the Stanhope in the office on a couple of occasions.
I imagine there are benefits. I have sensed that she is the one with the money, but who knows? People's private lives are never what they seem, including my own, until recently.
He gave Leona's thigh a squeeze. I don't know how you have such patience with such people, Leona marveled. No pun intended.
It's struggle, and between you and me, I can't stand them. Luckily, they are a distinct minority. I was trained to take care of sick people. Hypochondriacs to me that the same melangeries. If I had wanted to be a psychiatrist, I would have studied psychiatry.
When we get there, should I wait in the car?
It's up to you.
Greg said.
I don't know how long it'll be. Sometimes the corners me for an hour. I think you should come in. It would be boring to sit in the car.
It will be interesting to see how they live.
Hardly the average couple.
The Stanhopes lives in a massive 3-story Georgian-style brick house on a sizable wooden lot near the Chestnut Hill Country Club in an upscale area of Brighton, Massachusetts. Greg entered the circular drive and pulled up to the front of the building. He knew the road. He knew the road all too well. Jordan had the door open as they mounted the 3 steps. Greg had a black bag. Leona carried the ECG machine. She's in the upstairs in her bedroom, Jordan said quickly. He was a tall, meticulous man dressed in dark green velvet smoking jacket. If he marveled at Greg's and Leona's formal attire, he didn't let in. He didn't let on. He held out a small plastic vial and dropped it in Greg's hand before turning on his heel. Okay, so Jordan is a male. I thought she's a he. Well, here the description of Jordan. He's a male. All right. It was a free sample bottle of Zoloft Greg had given Patience that morning. Greg could see immediately that one of the 6 pills was missing. Obviously, she had started the medication earlier than Greg had suggested. He pocketed the vial and started after Jordan.
Do you mind if my secretary comes along?
Greg called out.
She can't possibly lend me a hand.
Leona had demonstrated a few times in the office her willingness to help out. Greg had been impressed by her initiative and commitment from the start. Long before he thought of asking her to a social events, he was equally impressed that she was taking night courses at Bunker Hill Community College in Charleston, with the idea of eventually getting some sort of medical degree as a technician or nurse. For him, it added to her appeal.
Not at all.
Jordan responded over his shoulder, waving for them to follow. He had started up the main staircase that skirted the Palladian window above the front door. "Separate bedrooms," Leona whispered to Craig as they hurried after Jordan. "Kind of defeats the purpose. I thought that was only the old movies." Craig didn't respond. They quickly descended a long, carpeted hallway and entered the feminine master suite, upholstered in a square mile of blue silk. Patience, her eyes eyelid heavy, was lying in a king-size bed, semi-propped up with overstuffed pillows. A servant in a demure French-maid outfit straightened up. She had been holding a moist cloth against Patience's forehead. With a quick glance at Patience, and without saying a word, Craig rushed over to the woman, dropped the bag on the bed next to her, and felt for a pulse. He snapped open the bag and pulled out his blue pressure cuff and stethoscope. As he wrapped the cuff around Patience's right arm, he barked to Jordan.
Call an ambulance! Call an ambulance!
With only a slight elevation of his eyebrow to indicate he had heard, Jordan went to the nightstand phone and dialed 911. He gave the servant woman a wave of dismissal.
Good Lord!
Craig murmured as he tore off the cuff. He snapped the pillow from behind Patience's body, and her torso fell back onto the bed like a rag doll. He yanked down the cover up, pulled open her negligee, then listened briefly to her thorax with his stethoscope before motioning to Leona to give him the EKG machine. Jordan could be heard speaking with the 911 operator. Craig fumbled to unsnarl the EKG lead and quickly attached them with a bit of conducting jelly. "Is she going to be all right?" Leona asked in a whisper.
Who the hell knows?
Craig's answer.
She's cyanotic, for Christ's sake.
"What's cyanotic?"
There's not enough oxygen in her blood. I don't know if it's because her heart isn't pumping enough or she's not breathing enough. It's one of the other both. Or both.
Craig concentrated on the EKG machine as it spewed out a tracing. There were only little blips widely spaced. Craig tore off the output strip and took a quick closer glance at it before jamming it into his jacket pocket. He then snapped the leads off Patience's extremities. Jordan hung up the phone.
The ambulance is on its way.
Greggs merely nodded as he rapidly rummaged in his bag and pulled out an amber breathing bag. He placed the mask over Patience's nose and mouth and compressed the bag. Her chest rose easily, suggesting good ventilation.
Could you do this?
Craig asked Leona as he continued to ventilate Patience. "I guess so," Leona said hesitantly. She squeezed between Craig's and the headboard and took over the assisted breathing. Craig showed her how to maintain a seal and keep Patience's head back. He then glanced at Patience's pupil. They were widely dilated and unreactive. It wasn't a good sign. With a stethoscope, he checked patient's breath sound. She was being aerated well. Back in his black bag, Craig pulled out the assay kit for testing for the biomarkers associated with a heart attack. He tore open the box and pulled out one of the plastic devices. He used a small heparinized syringe to get some blood from a major vein, shook it, and then put his drop into the sample area. He then held the device under the light.
Well, that's positive.
He said after a moment. He then haphazardly tossed everything back into his bag. What's positive?
What's positive? What's positive?
Jordan asked.
Her blood is positive for myoglobin and troponin.
Craig said. In layman's
In layman terms, it means she's had a heart attack.
With his stethoscope, Craig ascertained that Leona was ventilating patient appropriately.
So your initial impression was correct.
Jordan commented.
Hardly.
Craig said.
I'm afraid I have to say she is she is in a very bad situation. I was trying to communicate as much as the phone.
Jo- I was trying to communicate as much on the phone, Jordan said swiftly. But at the moment, I was referring to the heart attack.
She is worse off than you led me to believe,
Craig said as he got out some epinephrine and atropine, along with a small bottle of intravenous fluid. Beg your pardon? I was quite clear she was progressively getting worse.
You said she was having a little trouble breathing. Actually, she was hardly breathing at all when we got here. You could have let me know that. You said you believe she was rather blue, whereas I find her totally cyanotic.
Greg deftly started an intravenous infusion. He tapped the needle in place and gave the epinephrine and atropine. He hung the small IV bottle from the lampshade with a small S-hook he had made for that specific purpose.
I was doing the best I could to communicate to you, Doctor. I appreciate that,
Greg said, holding up his hand in a conciliatory gesture.
I'm sorry, I don't mean to be critical. I'm just concerned about your wife. What we need to do now is get her to the hospital as quickly as we can. She needs to be ventilated with oxygen and she needs a cardiac pacer. On top of that, I'm certain she is acidotic and must be treated for it.
The undulating sound of the approaching ambulance could be heard in the distance. Jordan left to go downstairs to let in the emergency technicians and direct them to the patient's room. Is she going to make it? Leona asked as she continued compressing the ambu bag. She doesn't look quite a blue to me.
You're doing a great job with that breathing bag,
Craig responded.
but I'm not optimistic since her people haven't come down and she's so flaccid. But well, no better when we get her over to Newtown Memorial Hospital. Get some blood work, get her on the respirator and pacer. Would you mind driving my car? I want to ride in the ambulance in case she arrests. If she needs CPR, I want to do the chest compression.
The EMT were an efficient team. It was a man and a woman who obviously had worked together for some time since they anticipated each other's move. They swiftly moved patients to a gurney, brought her downstairs, and loaded her into the ambulance. Within a few minutes of their arrival at the Stanhope residence, They were back on the road, recognizing a true emergency. They had the siren screaming, and the woman drove accordingly en route. In the male EMT phoned ahead to Newton Memorial to advise them of what to expect. Patient's heart was still beating, but barely, when they arrived. A staff cardiologist whom Craig Snow knew well had been summoned, and she met them on the unloading deck. Patience was rolled inside with dispatch, and an entire team began to work on her. Craig told the cardiologist what he could, including the result of the biomarker assays confirming the diagnosis of myocardial infarction or heart attack. As Craig had anticipated, Patience was first put on a respirator with 100% oxygen, followed by an external pacemaker. Unfortunately, it was quickly confirmed that she then had the problem of PEA, or pulseless electrical activity, meaning the pacemaker was creating an image on the electrocardiogram, but the heart was not responding with any beats. One of the residents climbed up onto the table to start chest compression. Blood work came back and the blood gases were not bad, but the acid level was close to the highest the cardiologist had ever seen. Craig and the cardiologist looked at each other. Both knew from experience that PEA had a distal outcome with a hospital inpatient. Even when caught quickly, the situation with Patience was far worse since she had come in by ambulance. After several hours of attempting all possible effort to get the heart to respond, the cardiologist took Greg aside. Greg was dressed in his formal shirt, complete with bow tie still in place. Blood spattered adorned the upper part of his right arm, and his tuxedo jacket hung on a spare ivy pole against the wall.
It must have been extensive cardiac muscle damage, the cardiologist said. It's the only way to explain all the conduction abnormalities and the PEA. Things might well have been different if we had been able to start on her a bit sooner. From your description of the time course, I imagine the size of the initial infarct significantly grew.
Craig nodded. He looked back at the team that was still doing cardiopulmonary resuscitation on Patient's slim framed. Ironically, her color had returned to near normal with the oxygen and the chest compression. Unfortunately, they had run out of things to try. Did she have history of cardiovascular disease?
She had an equivocal stress test a few months ago,
Greg said.
it was suggestive of mild problem, but the patient refused any follow-up studies.
To her and detriment, to her detriment, to her detriment, the cardiologist just said. Unfortunately, her pupils have never come down, suggesting anoxic brain damage. With that in mind, what do you want to do? It's your call. Greg took a deep breath and let it out noisily as a reflection of his discouragement.
I think we should stop.
I agreed. 100%, the cardiologist said. She gave Greg's shoulder a reassuring squeeze, then walked back to the table to tell the team it was over. Oh my god, the patient died. Oops. Let me relax for a while.